Isaac, over to you. So now, do we start from how important is dental care? Let's start from there.
Okay. Dental care is very important in the sense that the mouth is not an isolated organ. Just like every other part of the body, the mouth is a part of a whole. So what is happening in the mouth directly influences what happens in other parts of the body. And there can be a reflection of what's happening in other part of the body in the mouth. What I'm saying is that dental health is directly linked to other parts of the body, directly linked to other diseases in the body.
Okay.
For example, a common example is diabetes. All
Oh,
right, so
okay.
most people know about diabetes, so I'll just use that example. So
Okay.
a disease like diabetes now, oral health is directly linked to diabetes, such that someone with a poor oral health and with diabetes, in a patient with diabetes, poor oral health can worsen the diabetes,
Wow.
and also the diabetes can also worsen oral health problems like gum diseases and all that. So the mouth is not isolated. What is happening in the mouth can directly cause other problems in other parts of the body.
Mm,
So it's very important, very very
very
important.
important, right?
Yeah.
Okay. Now, what's the most common dental problem you see in your practice in Nigeria?
Well, um, most patients come in with toothache as a result of tooth decay.
Okay.
That's what most Nigerians eventually come to the clinic for.
Okay. So what causes this? Hello, Dr. Isaac.
Yeah, hello, I can hear you.
I said, what causes this tooth decay and the toothache?
Oh, okay. Tooth decay is um has a number of factors contributing to it. Um, Usually it's an interplay between sugar, bacteria, time, and all that. But basically, to explain this very simply,
Yeah.
tooth decay happens when uh, there's some bacteria in the mouth that will act on sugar, that will produce acid, and that acid starts to decay the tooth, starts to eat up the tooth. So
Okay.
basically, for someone who consumes a lot of refined sugar, maybe soft drinks and chocolates and all that, if you take that very often, you are more likely to come that to have to decay, as it were.
Okay.
Also, in people that have very poor oral hygiene practices, you don't brush properly, you don't brush as often as you should, and all that, you are more likely to come down to decay.
Mm.
So basically, that's
Okay.
it.
Yeah. So now is it how often should people visit the dentist for checkups? Is a dental checkup as important as every other health check?
Yes, yes, yes. Um, Usually, we advise that you come in every 6 months for dental checkups for the routine cleaning called scaling and polishing, where your teeth are cleaned professionally. This is important because most dental diseases, including tooth decay that I just mentioned, whether it's tooth decay, whether it's gum disease, or any of the rest, most of them slowly progresses, and the earlier the better. For example, in tooth decay starts very small. In fact, by the time when tooth decay is starting, there is no pain, there is nothing. In fact, most likely the patient will know that there's anything going on, but it's already there. So for someone who comes for a regular dental checkup, the dentist will pick it up and
Mm.
fix it before it gets deeper. Because if it is left like that, let's assume the patient um, is not someone who comes for regular routine dental checkups. If the tiny decay is left like that, the decay continues to get wider, continues to get deeper. Then at a particular point, pain will start. The pain will start mildly,
Mm.
maybe just when the patient is eating and food enters the decayed part, commonly called tooth hole.
Mm.
It's commonly called tooth cavity. Maybe the food starts entering the cavity. The pain starts mildly when the food enters the cavity. Maybe after the patient removes the food particles with something, the pain stops. And as the decay gets deeper, as the cavity gets deeper and wider, the
Mm-hmm.
pain progresses into something very terrible. You can't sleep again, you can't eat again. That's when most Nigerians actually come to the clinic. That's when we see them.
Okay.
And if you leave it at that, you still refuse to come to the clinic, the whole thing escalates, the infection spreads beyond the tooth into the surrounding bone and tissues, there is swelling, there are terrible complications, which
Mm.
can eventually actually lead to death
Mm.
if it's
Yeah.
not taken
I
care of.
was going there actually. So I heard of someone recently that died. So this is someone like close to the family. She had the hole in her teeth. I think I don't know the back one. He wasn't cared for. Cause of death was, but on the long run, anyway, it affected the whole gum. I'm trying to ask you what could cause that anyway. And then before she could go for surgery and everything, I think it decayed into the gum. That's what we were told. And before she could do whatever surgery she had to do, the jaw thing, she passed on. So what could be the? Is it that like you said, when it progresses, it can lead to infection of the entire jaw? Yeah.
Tooth decay, when it progresses, it starts from the tooth. But the tooth is not alone. It's not a lone tissue, as it were. The tooth is sitting inside the bone,
Mm-hmm.
surrounded by tissues like the gum and some other tissues. And the bone is also surrounded by different soft tissues like the muscle and so on. So the infection doesn't just stay within the tooth. If it's left like that, it progresses beyond the tooth into the bone, where the tooth is sitting inside the bone. That's why the tooth is firm. If you touch your teeth now, if your tooth is
Mm-hmm.
healthy, your teeth should not be shaking
Mm.
because it's sitting very well inside the bone, supported by other tissues like the gum and all that. So when the infection spreads beyond the tooth, spreads, it goes into the surrounding bone, into the surrounding soft tissues, the muscles, and all that. So, and by the time it gets to that stage, um, there are different factors that can affect how fast the infection will now start spreading. For example, now if it's someone that is already not healthy, as it were, maybe someone with a systemic disease, uh, uh, maybe someone with an uncontrolled diabetes, maybe someone with a very high blood sugar,
Mm.
maybe someone who is diabetic and has not been using their medications,
Mm.
and the blood sugar is out of control. The infection will start spreading very, very, very fast,
Mm.
very fast. And as the infection spreads very fast, that's to spread to other parts of the jaw and all that, which can
Mm-hmm.
eventually lead to death.
Hmm.
That's the
There's
okay,
no
which
there's
can
no
eventually
nice
lead to
way
death.
to
Yeah.
put it. Yeah, it's just going to lead to that. All right. Now,
Pardon?
no, I said, there's no nicer way to put it. It's eventually going to lead to that if it's not looked into, right?
Oh, okay.
All right. Now, still talking about what you mentioned something about teeth shaking. So what causes that? What could be the cause of it if it's been going on for years and, you know, what causes teeth shaking?
What causes what?
You mentioned when the teeth is shaking, it's a sign that it's not healthy. So, what are some of what is the cause of that?
Oh, okay. Well, I'll just pick it up from where I was saying. The tooth is sitting inside the bone. Um, if everything is fine, there's nothing wrong with the bone. There's nothing wrong with the tissues surrounding it. Nothing wrong with the gum and all that. The tooth should not start shaking. Now, if it starts shaking, that's an indication that something is wrong. It's usually a problem with the structures supporting the tooth, structures like the gum. It starts from gum disease. When the gums are inflamed and all that. When there's a problem with the gum, and it's not taken care of, it starts to spread. The problem with the gum spreads to other tissues supporting the tooth. Eventually gets to the bone. The bone starts to trying to find a way
Mhm.
to
Nice way,
the
Abby.
the bone starts to eat up. Let me put it that way. Okay, the bone starts the whole disease starts to eat up the bone,
Mm.
and when it starts to eat up the bone, the tooth starts becomes more shaky
Hmm.
because the bone is supposed to support the tooth, right? So when the bone starts getting eaten up by the disease and all that, the tooth starts shaking and all that, and
Mm.
eventually could lead to tooth loss.
Tooth loss.
So
I like
it's
how
a
you
problem
just
with
call
gum
it as it
disease that
is.
eventually gets more extensive,
Yeah.
and all
Yeah.
that. Yeah.
All right, if you're listening, this is Spotlight on Super FM. We're looking at availability and accessibility of dental care services in Nigeria. First of all, we're going over dental care, some of the common problems. We have a dental surgeon on the line with us, Dr. Isaac Adeyemi. And if you'd like to ask questions, dental care related questions, you can call in on 0805 092 That's 0850920927 or 0705 8904927. You can also send a WhatsApp message to 0705 6900927. So the point of this is to create awareness and not to scare you if you're listening on the other end. Because, Dr. Isaac, if people just hear it leads to this, it leads to that, like it might just be a bit scary. And then you're just wondering, like, even if there was nothing in your teeth before, you start checking to see if there's something there. Okay, let's take this call, Dr. Isaac. Are you with me or I'm alone? Hello, good morning.
Hello, good morning, Kimberly.
Good morning to you. What's your name and where are you calling from?
Yeah, my name is Mr. Ladojo, calling from Yaba.
Oh, okay. How's Yaba this morning?
Yeah, Yaba is cool. Yaba is cool.
All right, welcome.
Thank you so much, Dr. Isaac. Okay. So, my own challenge is that, I also have the issue of toothache, as you have said. I removed one of my teeth already, but I also have another one that is that there is a hole presently. Okay, so I'm trying to manage it. So although I don't want to remove it again, I don't know if there's anything I can do to that. And also the maintenance aspect. You mentioned eating sugar and all whatnot, bacteria being released, and that causing tooth decay. So how often are we meant to brush our teeth on daily basis? Or is there any probably, I don't know, probably like drugs or anything that can be recommended to make us have improvement?
So,
on that particular.
Thank you, but we can recommend drugs over the radio. But he can just give you guiding tips. I'll convey your question. Thank you very much. Thank you for calling in. Now, Dr. Isaac, are you with us?
Yeah, I'm here.
Did you hear the question?
No.
Okay. He said he has issue with he had toothache, so he took out one tooth already, but now there's a hole in another tooth, and he's just trying to see if it's something he can manage without having to remove it. Do you advise that he just continues to manage the other one that has hole already? And he's asking how often, when you're talking about maintenance, how often should one brush his or her teeth?
Yeah, so for the person who called in, well, you don't have to go for a tooth extraction. You can talk to your dentist about other options. Could be more expensive, but we don't like removing teeth unless absolutely necessary. Maybe the patient can afford the other kinds of treatments. There's a treatment called root canal treatment. It's a kind of extensive procedure that can be done on the tooth to remove the infection from the tooth and to treat the tooth and all that. So you can talk to your dentist if that is applicable in your case, if that will work. So instead of when you have to decay or to take, the next thing coming to your mind should not be I want to have the tooth removed.